Our fourth talk for the day is given by Dr. Abdulaziz Bakhshwin. Dr. Abdulaziz is a general surgery R1 at KFMC. Doctor, thank you so much for agreeing to give this talk. You can start whenever you're ready.
Thank you so much. Can you allow me to share my screen?
Yes, Doctor. Just a second.
Okay, you should be able to now.
Yes. Just give me 1 second. All right. Assalamu alaikum, everyone. Can I start?
Yes, Doctor.
Okay. My name is Abdulaziz Bakhshwin. I'm a GS President R1 at King Fahd Medical City. And today I'll be giving you an overview of the specialty, inshallah. Why GS? I get a lot of people ask like, why should we choose GS, or why did I choose the specialty? One big reason is it has a greater exposure to a wide variety of subspecialties. You know, in GS you get to do not only like abdominal surgeries. You know, you get to do trauma surgeries. You get to do thoracic surgery. You get to do vascular surgery. You get to do breast endocrine surgery. So you have you know, a bigger scope, a bigger exposure to different specialties, different surgeries. And this will help you like in the future to have a choice that you really like when you go on to fellowship or advanced studies. You will have a better picture of the specialties. So more options for fellowship. That's it ties in with the exposure and the wide variety of cases. There is a balance between medical and surgical knowledge. So people think that surgeons can only do surgeries. They don't have any medical knowledge or any background to treat medical conditions. And this is one of the myths and misconceptions about surgeons. Surgeons, what's special about them is that they can treat medical conditions at the same time they have the skill to do surgeries. And in GS, there is a very good you know, balance between medical knowledge and surgical skills. So you will be exposed in the medical field, in the medical management of patients. It's not only about going to the OR and doing surgeries. Relatively, it has an easier acceptance and more lenient acceptance rates here in KSA and also abroad, compared to other, you know, surgical subspecialties, for example, orthopedics or ophthalmology or neurosurgery or plastics. GS is relatively easier to get into. It's less competitive. So myths and misconceptions. As I said before, some people think that surgeons do not know how to treat medical conditions, and that's totally not true. Surgeons do know how to treat medical conditions, and they are trained and they have the knowledge and the tools to treat medical conditions. Although sometimes they might need help or the input of, you know, medical doctors, like those who are doing doctors in internal medicine or like infectious disease or whatever medical specialty. But at the end of the day, they still can treat medical conditions, and they have the knowledge and the skills to do that. Some people think that surgeons have no life, and that most of the time they're staying at the hospital, but that's also not entirely true. Of course, there are some days where you have to stay in the hospital for longer than expected. So some people might think that I will go to the hospital from 8 to 4 and then go home. For surgery, it doesn't really work that way. Usually you have to be in the hospital earlier and you'll have to leave later than uh, uh, other other doctors in other specialties. Uh, but that's not, a persistent pattern. It doesn't happen every single day. Yeah, maybe like once a week, twice a week, but it's not a pattern that happens every single day of the week. Uh, so uh, surgeons do have a life. They do have fun. They have uh, interests outside of their field and interests outside of the hospital. So it's a common misconception about surgeons, especially general surgeons. Traits for GS, like personality traits, hard work. You have to be willing to put in a lot of hard work, and you have to be willing uh, to be able to stay focused for prolonged periods of time, because uh, it's not only about going to the hospital and seeing the patients. There are also on calls. There are also education activities, presentations that you have to work on. You have to work on your own skills, your own hand skills, your own knowledge. Like on top of the workload that you'll be handling at the hospital and the patients that you'll be seeing on a daily basis, you have to also develop your hand skills, your knowledge. So it requires a lot of hard work, a lot of planning, a lot of time management, and you have to be patient for that. So patience is very important, especially when it comes to learning surgical skills. Surgical skills do not come overnight. You're not going to be able to tie a knot in one surgery. You're not going to be able to make a perfect incision in one day. It takes a lot of time. It takes a lot of practice. It takes a lot of patience to be able to get to that level, to the level of being an expert. And of course, team player, because surgeons do not work by themselves. They work in teams always. When you go to the OR, when you attend the surgery, it's not going to be one surgeon doing the entire thing. There are going to be two, three people standing with him, assisting in the surgery. So being a team player is very important as well. Not only with your fellow doctors, also with nurses, with other people who are involved in patient care, like dietitians, pharmacists. You always have to be connected with them. You always have to seek their input and seek their advice. For me, what were the other choices that I was considering when applying? Uh, I was leaning more towards surgical specialties. I was thinking about pediatric surgery, plastic surgery, and orthopedics. But as I said before, GS will give you greater exposure to a wide variety of subspecialties. So when you do a fellowship later on, you will have more choices to choose from, including pediatric surgery, including plastic surgery. GS, those or doctors trained in GS, they can pursue a fellowship in pediatric surgery. They can pursue, fellowship in plastic surgery. So that's why I prefer to do a GS to do my basic training in GS, so I can have more options later on. I didn't want to go into a subspecialty from the beginning, because I did not want to limit myself. So what are the types of patients that we see on a daily basis? It's really variable. We have simple, straightforward patients coming with acute appendicitis or acute cholecystitis. We just treat that condition, and patients are happy and they go home. Sometimes you have complicated cases and difficult patients with multiple comorbidities, patients with cancers requiring multidisciplinary teamwork. Uh, Patients, sometimes we have patients that stay in the hospital for 2 months, and you have to see these patients on a daily basis, and you have to be able to manage them well. At the same time, these patients will over time they will get tired, they will get bored. So you have to also work on that. You have to convince the patients that their condition requires them to stay at the hospital. Sometimes patients will not listen to you, so you have to convince them uh, that we're doing the best to help them. You will see critical and severely ill patients in the ICU, patients coming to the ER with for example, severe trauma or patients in sepsis. So you will see critically ill and severely ill patients and demanding patients. Some patients are demanding. They just, no matter what you do to them, they don't appreciate or they don't like the way you approach them or the way you manage them. They want to be managed in the way that they like to be managed. They don't listen to you. They don't take your advice, and you're gonna have to deal with that and uh, find a way to convince these patients and let them do what's best for them. So, what does a typical day look for a general surgery resident? Usually, I wake up at 6, sometimes before that. I like to be in the hospital at 6:30 maximum, so I can see my patients, and then I will round with my senior or with the consultant at around 7 or 7:30. Uh, Usually have 1 or 2 days per week where we have OR, where we do surgeries. Usually they start at 7:30. So on these days we have to come even earlier. So I have to be in the hospital like at 5:30 so I can do my rounds with my senior before the surgery starts. And usually we finish at sometimes at 4, sometimes at 5, sometimes at 8 in the evening, depending on the complexity of the cases in the OR. Clinics, we are 1 to 2 clinics per week. Usually clinics are very straightforward, nothing complicated, nothing advanced. You just see patients. Usually they come for follow-up. Uh, Usually it's not a long day. Usually from 8 to 4, the clinics. So most days I finish at 4, sometimes at 5 p.m. That's most of the days in a typical day. If we have critically ill patients or we have a complex case in the OR, yeah, I might have to stay until 6, 7 p.m. in the evening. But that's not a typical pattern that happens every single day. Maybe once a week, maybe once every 2 weeks. Uh, that's the usual. Educational activities. There are of course educational activities. Uh, like in my hospital, we have 2 kinds of activities. We have the resident activity. It's a weekly activity where a resident will choose a topic and will present that topic. Whether it is hernia, whether it is bowel ischemia, whether it is acute cholecystitis, acute appendicitis, whatever it is. They just come, prepare that topic, and present it to the other residents. And the goal of this activity is to cover all necessary surgical topics that you might see in your practice and that might come in the exam, in the board exam or the promotion exam. Uh, Departmental activity. This is a activity where uh, the entire like general surgery department will attend. Usually the consultants will be there, the fellows will be there, and usually it's not about a specific topic. Usually they present a study, a research study is presented at that activity or a case presentation. Okay, so a case presentation about an interesting case that was managed in the hospital. They will present that case in the department activity. Grand rounds, usually they are weekly, and they're very good learning opportunity where you round with 2-3 different consultants. You round on maybe 10, 20 patients, and the consultants will try to educate you, will try to ask you questions about the patients, about their condition. So you'll get to be exposed and you get to learn on the spot. And usually they're long. They take 2 to 3 hours to finish, but they're very helpful and beneficial. On calls, typically we get 4 to 6 on calls per month. We have usually one mega call where you cover. It's a weekend coverage, either Thursday and Saturday or Wednesday and Friday. It's called a mega call. So you'll be covering 2 days over the weekend. And on calls, it depends on your luck. They can be hectic or they can be simple. You might have 10 patients, you might have 3 patients. It just depends on your luck, basically. There's, nothing, uh, nothing you can do about it. But typically, like on average, you get 4 to 5 admissions per on call. Sometimes less, sometimes 1 or 2, sometimes more. Sometimes you get 6, 7 admissions, and usually one to 2 emergency surgeries per on call. Uh, and again, this is not always the case. Sometimes you get more, sometimes you get less, sometimes you get none. Sometimes we don't go to OR during our on call. Life outside the hospital. Uh, I think it's comfortable. Uh, Sometimes you have to spend more hours in the hospital, as I said before. Uh, and weekend rounds can be a nuisance. You know, the patients in the hospital, they need to be seen every day, including the weekend. So during the weekend, uh, some hospitals will let the on-call resident do the weekend round. Some hospitals will assign residents to do the weekend round. So sometimes in one hospital, they assign two residents per weekend to cover the round. Even if you're not on call, you have to come and see the patients and write their notes and put their orders. And sometimes it's annoying because uh, a weekend is for you to chill and sleep and have fun, but during that weekend you have to wake up early in the morning and go to the hospital and do your job. Uh, so, like in general, at least 2 weekends per month, you have to be in the hospital. Okay. Usually, that's the usual. Future opportunities. So GS, it has many subspecialties that can accommodate your interests, as I said before. Job opportunities and senior positions are getting more and more competitive and limited, especially in big cities like Riyadh, Jeddah, Dammam. Uh, if you're looking for a senior position in these cities, it's going to be difficult. It's going to be challenging, and usually it will require outside training. So you have to be certified from outside, like from Europe or Canada or the US, or you have to have certification or something from outside to receive that promotion or to be or to have a senior position in the hospital, especially in big cities. So as a final advice, GS is a demanding specialty, so it has higher workload, and relatively the number of residents is not that much. So the workload is going to be hectic sometimes. Sometimes you will wish that you want to go home, but you can't. So before you decide to go to GS, you have to try it in multiple centers, in multiple busy centers. Don't try GS in a small center where there is no workload. No, try it in a big center with a high workload, so you can actually experience GS before you decide to go into it. If you can handle the 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 workload and you can handle the sometimes the stressful lifestyle, go for it. It's a very nice specialty. Uh, it has a lot of exposure. There is balance between medical knowledge and surgical knowledge. It will give you a lot of options in the future. You'll not be limited to certain specialties or certain subspecialties. And always seek the advice of those in the field. So if you do a rotation in general surgery in whatever hospital, ask the seniors, okay, ask the consultants, ask them about the specialty and uh, uh, what do you think about it? What are the opportunities in the future for residents doing GS? So always seek their advice. And that's it. Thank you for listening to me. If you have any questions, I'll be happy to answer.
Thank you for the wonderful presentation, Doctor. It was indeed very beneficial. We truly value your experience and guidance. And if anyone has any questions, please feel free to put them in the chat now or unmute yourself and ask a question.
I think we already have 2 questions in the chat. Someone is asking how many years GS?
It's 5 years.
And someone else is asking, is KFAFH considered busy in Jeddah?
I don't know what that is.
Osama, can you elaborate on what you mean?
السلام عليكم.
عليكم السلام.
السلام ورحمة
Hello.
الله.
شكرا جزيلا دكتور عبد العزيز. بس حبيت أسألك, you mentioned that we should يعني get some hands-on experience in terms
Yes.
of GS and
Yes.
seeing if it's busy ولا لا. KFH is the المستشفى العسكري اللي بجدة.
Okay.
Is considered busy ولا؟
I think يعني usually the اللي هي military hospitals غالبا تكون busy. يعني احنا في الرياض عسكري جدا جدا busy. فأتوقع في جدة حيكون نفس الشيء يعني.
Okay. طيب in terms of يعني as a third year medical student, what should I focus on if I'm interested in GS?
يعني you can take there are multiple courses اللي تقدر تاخذهم في مثلا زي ال surgical skills course يسموه BOSS course. You can take that عشان to get at least يعني an overview of the skills that you will need in GS. في السمر في فترة السمر بريك تقدر تاخذ يعني electives عشان يعني تشتغل وتشوف وتجرب. فهذا الشيء تقدر تسويها يعني try to take courses especially surgical skills courses. You can take ATLS course. هذا it will be very helpful يعني for GS.
شكرا جزيلا دكتور. I took an elective, a 1-month elective in general surgery. بس is that important يعني in terms of the interview, in terms of the CV وال points يعني would that يعني help me get accepted ولا؟
which year are you now? Third year?
Yes.
يعني شوف it's good to have يعني experience from now. يعني حتى لو دحين انت عندك يعني جربت اخذت elective في الجنرال سيرجري حيكون عندك علاقات, حيكون عندك connections مع الدكاتره اللي اشتغلت معاهم. بعدين في سنه الامتياز في الانترنشيب تقدر ترجع له مره ثانيه وتشتغل معاهم وقتها عشان يكتبوا لك recommendation letter عشان يتذكروك وقت المقابلات. فحلو انك من دحين تبدا تبني علاقات معاهم من هذه الفتره عشان بعدين في وقت الانترنشيب يشوفونك يشتغلون معك ويكتبوا لك recommendation letter.
طيب شكرا جزيلا دكتور, الله يجزاك خير.
دكتور, GS residents هل عندهم وقت كافي to do research papers عشان to help them for fellowship?
To do what?
To do أكيد ال fellowships research عشان ال fellowships need some
yes, that's true. To be honest, I'm not really sure. For me يعني I'm trying to be involved in research, but sometimes I find it difficult, especially because of the long work hours sometimes. But sometimes you have light rotations. For example, you have ER rotation. 3 months doing ER rotation. It's not a busy rotation. So during that time, maybe you can work on research. So maybe try to find time in the rotations where you don't have a lot of work to do some research.
Thank you, doctor. One more question. Doctor, the GS, then after that fellowship into plastic surgery, and on average, do usually they become great for the field or لا? As someone coming straight to plastic surgery?
I'm not really sure صراحة if you compare them if you compare someone who is doing plastic surgery from the beginning or someone doing plastic surgery after GS. But if someone is doing plastic surgery after GS, you will be doing 3 years of plastic surgery. So you will have enough exposure. You'll have enough exposure and you'll have enough skills to be maybe at the same level as someone who's doing plastic surgery only. And don't forget, like someone who has a general surgery background will have a lot of exposure to different different types of patients and different surgeries, including vascular surgery, including breast endocrine surgery. And these kinds of procedures are not done in plastic surgery. So their skills will, I think, they'll be the same. Maybe the plastic surgeon will have more knowledge related to plastic surgery itself. In terms of surgical skills, I think they will be the same.
يعطيك العافية دكتور. It was so great.
I can't hear you.
قلت يعطيك العافية دكتور. It was so great.
الله يعافيك الله يعافيك الله يعافيك.
Okay, so any more questions? Okay, so thank you very much, Doctor.
Thank you so much.
It was delightful, and we loved having you here today with us in the talk. And to everyone in the meeting, we'll be back at, we'll take a break till 3:30.
Thank you so much.
Thank you.